So, what are some of the new markers that help us in diagnosing, staging, and the prognosis in prostate cancer? If we go back in history in prostate cancer, there's a rich history. The first tumor marker in oncology dates back to 1939, and that was in prostate cancer. That was a marker called acid phosphatase. And then probably what's been heralded as the most important tumor marker in oncology is in prostate cancer, and that's PSA. And PSA is very good to monitor prostate cancer in men that have had like surgery. If you had surgery, your prostate's removed, you shouldn't have PSA. PSA is specific for the prostate. And women don't have PSA. Men that have prostate cancer or recurrence of prostate cancer will have an elevated PSA. So those have been served us well, but they really haven't been terrific. And so what else do we have? Well, in the past couple of years, it's been very exciting. We've had several new markers that have come on into the arena of prostate cancer, and they really fall into three buckets. The first bucket is a marker that helps us diagnose the cancer. The second one is a marker that helps us diagnose the cancer in people that have had negative biopsies and you're still worried. And the third has to do with, once you're diagnosed with prostate cancer, things that help and determine the aggressiveness beyond the Gleason score or the grade of the cancer. So the first bucket is when to biopsy somebody, and that's been predominantly PSA, but PSA is not specific for prostate cancer. It goes up with prostatitis and more commonly size of the prostate. And so there's a new test called PHI, which is called Prostate Health Index, that looks at PSA and percent-free PSA that helps us. And then there's something called PCA3, which is a urinary test for prostate cancer that looks at this called messenger RNA from genes that are expressed in prostate cancer. The second bucket is in men that have had biopsies, but they're negative. And remember, you can't sample the whole prostate. And there's a new test called MDX Confirm. And what this test does, it's very interesting. There's kind of a halo around the cancer where even though the cells look normal, there are changes in the DNA, it's called methylation, that can be stained for, can be looked at, and can tell you this is in a sort of a radioactive zone, so to speak. This is in a zone where there might be prostate cancer. And so we do that test on the biopsies that are negative, and it comes back showing this changes or methylation. We can go back to the area and biopsy it. So that's a real step forward. And then the third bucket has to do with men that are diagnosed, and let's say they have a low-grade cancer, but some of these low-grade cancers behave benignly and don't cause a problem, and others do cause a problem. And so how can we help that? And we help that with the use of other new markers, and these new markers include things such as something called a Prolaris test. The second one is OncoDX, and the third one is called Decipher. And what these basically do is look for gene changes, and some of them are cell proliferation genes that are present in things that we do on biopsies and specimens that have been taken out to help us determine the aggressiveness. And this is an exciting new area in prostate cancer that we didn't have before.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.